Well, I think we've just been challenged.
Yes, sir.
I'm excited about this two dynamic presentation. So now it's your turn. It's your turn to ask questions, clarify points, have something to say. There are two microphones, and we really need you to use the microphones because this is being webcast and we want Marshall to hear us. So I see, welcome Tony stepping to the podium, never afraid of a challenge.
Hi, good morning.
Tony?
Tony Eiton from the California Endowment.
Where are you?
Marshall, can you hear Tony?
I can hear him, but I can't see him.
He's out of the camera. You won't be able to see him. You can only hear him.
Oh, no.
Sorry.
Well, okay.
First of all, it's such a delight to hear a presentation on this issue at the IOM. I'm just so delighted to be here on this occasion. But simple question. Can you diagnose Occupy Wall Street? What was that?
Well, I'm sure Francesca has her perspective. My own perspective is that it was a tactic in search of a strategy, and it was a great tactic. And as a great tactic, it succeeded in shifting the discourse. I mean, it really did. The 99%, the 1%, that was a big breakthrough at a discourse level. But it didn't build the power that was needed because it wasn't embedded in a structure capable of strategizing. And it couldn't go beyond what it was. It's as if there was one sit-in, and that was the only tactic the civil rights movement ever used. And that was it, and that was all over. See, the need for constant tactical adaptation, because your opponents learn how to adapt to your tactics, and so that's why a strategic level of analysis and understanding, and it's not just understanding, there has to be an organizational venue in which the strategizing goes on. If that doesn't exist, then it's not happening. So, I mean, I think we were blessed with a great intervention there. I think I don't think taxes would have been an issue in the campaign had it not been for Occupy. But I think we, and I include myself, others who care about the whole question of economic justice, couldn't figure out how to make more of it. That's my take.
Yeah, I agree. Sorry, I agree that there was tremendous potential there that may not have been most effectively used. A lot of people say the problem with Occupy was that they couldn't agree on a goal, and I don't think there was any possibility of that. In fact, what I would have preferred to see is more kind of freedom for people within Occupy to choose different issues and go out and organize around them. So if there were people within Occupy who wanted to work with progressive congressional candidates, they should have gone off and done that. If there were people who wanted to go off and squat in foreclosed homes, they should have gone and done that. There was some mobilization around student loans, but I actually would have liked them to take that opportunity. It had a tremendous media coverage, tremendous interest, support from surprising allies, and pushed it in a lot of directions.
Please.
Thank you very much for your presentations. I'm Terry Allen. I'm a member of the Population Health Roundtable, NACHO, also with the Cuyahoga County Health Department in Cleveland.
Hi, Terry.
Hi. Listening to Francesca talk about having an enemy, you need an enemy. And public health, lifestyle change just doesn't cut the mustard. So that resonated with me and perhaps lots of people in the room. So I started to think about that question. And our enemies sort of vary. Yeah. And being strategic about concerns about alienating folks come to mind. Industry, is the built environment the enemy? Mm-hmm. I think I'd be interested if you could sort of ponder that a bit for us, because I think that's one of the challenges. I've heard a state health director in Ohio say that public health is the greatest story never told. Yeah. And I think that's one of our challenges, is that's just not our cup of tea, our understanding of this literature that is holding us back and shaping this work. And so I'm hoping we have a chance to have some dialogue about this very topic as we talk about the concept of a movement. So thank you.
Yeah, I think that's a good point. I'm hoping that you'll have the answer to the question. I don't know. You know, enemies seems like the wrong word, right? Because we don't want to antagonize everyone. But we know that having an antagonist is mobilizing. We know that the media covers stories of conflict, right? So that if you present your story, then they're going to want to have the opposing side. I mentioned Bill McKibben, the environmentalist, who's really struggled with this, and he came out and said, we have to oppose the oil industry. That's the enemy. And then a number of people in the oil industry said, hey, we're actually really trying to make some changes, and you're casting us with too broad a stroke. So I don't know the solution, but I'd love to hear your ideas about that.
Just a thought on that. I mean, I think that you have to be clear about what you're fighting for. And I think an articulation, a powerful articulation of what's the value at stake here, what's at risk here, is critical. Because then the opposition emerges as what's getting in the way of the realization of this good. Often maybe acting even in contradiction to their own stated values. I mean, Gandhi talked a lot about moral jujitsu, about your stated values of your opponent, and you leverage. Demonization, I think, doesn't get you very far. But I think the problem is resistance to strategic focus, because that's kind of the issue. It's sort of like you want to do something about climate change. Well, how do you get a handle around that? Well, it turns out there are decision makers, fossil fuel companies, universities. And so unless we're able to focus and target, not because they're evil, but because they're decision makers, they have the power to choose whether to act or not. And there's a lot of resistance to that. Because of this sort of conflict-averse kind of talk out there. I mean, just this little controversy about third way and some of this in the news yesterday around Elizabeth Warren and all that. This kind of fear of conflict as somehow undermining the democracy when democracy is a form of conflict. I mean, that's how it is. It is a form of contention. It's what it's for. So I don't know. Reclaiming the sort of healthy nature of conflict, I think, is important. But I wouldn't get too hung up on the enemy. I think that I think it's really important to be clear about what the goal is, and then these people get in the way.
Yes, good morning. My name is Marta Arguello with Physicians for Social Responsibility. I have a couple comments, and as a practitioner, this conversation has been incredibly exciting. And I want to pull, I think, this difference between mobilizing and organizing, and the other part is, which is really critically important, and I think even some of us who are practitioners in the movement get very confused. Funders also get very confused because they like to see this big crowd. Oh my God, this group must be fantastic. They're really creating change because they got 1,000 people out. But at that critical vote, no one's there, but maybe one or two. So I think that those are really sort of important distinctions to make. And the other, with all due respect to Mr. McKibben, the father of the climate, he's not the father of the climate movement, and that many of the folks within the environmental justice movement have been talking about climate and social equity for a long time. And again, I think it's incredibly important when we're talking about leadership to make that leadership broad and recognize the folks who've been in those trenches for a long time. Again, especially for academics and funders, because that's where the resources will end up going to sort of, no offense to anyone, but the guy on the white horse. And to the exclusion of the folks who have been doing this for no money for a long, long time, because they're in the front lines of what the oil industry does. So I think those are really important distinctions as well.
You want to speak about the organizing?
Yeah. I think you're absolutely right. That's the problem. Is how do you measure the impact of organizing, or how do you show people that organizing is having an effect, right? As Marshall suggested, it's about building relationships, but those aren't easily turned into numbers or into something quantifiable. I would argue for organizing, that's sort of the basis, but I would also argue for sort of creativity in the forms that your organization takes and the tactics that you use. I keep thinking about 1988, a public health professor, I can't remember his name, from Harvard, convinced producers in Hollywood to start using the term designated driver in their sitcoms, and that they found that within 6 months the word had become sort of conventional. Everyone used the term designated driver. The rates of people having designated drivers in their cars went up dramatically, right? So that one person didn't substitute for organization, but that was a kind of creative way to take advantage of an opportunity in multiple spheres.
You actually can count progress in organizing. You're just counting something different, and because you're counting members, you're counting leaders, you're counting all the infrastructure building work that it takes to go on. There was a moment in 2008 in the Obama campaign when the equivalent of mobilizing in that context was counting votes, voter ID. And the organizers in Ohio and other places said, we have to shift and focus on building our capacity, which was volunteers, which was leadership teams, which was the kind of organizational infrastructure. And they succeeded that summer in for 6 weeks shifting the focus on counting infrastructure building away from the more obvious mobilizing count, which of course then helped focus the attention there so that then there was something to do the mobilizing with. It's the only time I've ever heard of that happening in a political campaign. And of course, this is no, special stake. I'm not saying Obama does everything great. I'm talking about the campaign in this particular context. And so, but I think that funders do want, razzle dazzle, quick action, and the way movements get in hock to funders is a huge problem. And being smart about operating without a lot of funding is a little bit how you free yourself. Generating other sources of funds, or at least competing sources of funds. But this idea that organizing is grant-driven, that's not going to produce a whole lot of change, I don't think.
Okay, on this side now.
Yeah, Mary Pittman from the Public Health Institute and a member of the Population Roundtable. I think we learned in the tobacco movement that having an antagonist to demonize was an effective tool. And I know in some of the other issues, there isn't kind of a single antagonist, and so it's more diffuse, and it's more difficult to do that. I think the antagonists sometimes learn to do the kind of branding that Francesca was talking about. I'm wondering if you could talk a little bit about being co-opted by the antagonist, providing a new brand and kind of covering over what their real intent is by using the language of the movement.
Yeah, and then that's been a criticism often leveled at groups like BP and other oil companies that have now glossy advertisements where they talk about local movement building, and I think that's a real struggle, and when I talked about my definition of social movements, and Marshall's both emphasized the fact that the people in social movements are relatively powerless, right? So the contest is always going to be an uneven one. Right? And so there is always absolutely that danger of co-optation. And that's where having an organized movement rather than a bunch of entrepreneurs becomes important, I think. Because these are the people who are going to say, this is a kind of strategic trade-off, and we're not going to accept glossy advertisements in lieu of an actual commitment to change.
Marshall?
No, I mean, I agree. I mean, of course, whether it's greenwashing or whatever it is, that's as old as the books. And I mean, that's older than the books, that kind of approach. Alinsky, the community organizer, once said that organizers have to be well integrated schizoids because you have to polarize to mobilize and depolarize to settle. And the polarizing, that is defining who the opposition is and returning to that definition. But of course, something Alinsky always counted on was that if you put enough pressure on the opposition, they will make mistakes. And that creates the opportunity for you to act. Now, they don't always, but you'd be surprised. So, but yeah, it is a, the reason I object to demonization is it seems like it gives the opponent too much power.
Right.
You know, if you've ever heard the Henry V speech on the eve of the Battle of Agincourt, that famous "We Happy Few" speech, where he's trying to give his men courage to face the overwhelming French. He never mentions the French once in that talk. It's all about enhancing his men's sense of their worth and value. And the opposition has to be named, has to be called out, has to be recognized to opposition. But I also think we need to avoid giving it too much power.
If I could just return to a point you made earlier in response to your point, Mary, that hypocrisy is a powerful tool for movements. And so if a company is attempting to co-opt, then that provides an opportunity for a movement to say, these are your so-called values, your actual practices diverge wildly.
Yeah, that's right.
Hello, Catherine Bozzi. I'm the Chief Health Officer for the Dow Chemical Company and a member of the Population Health Roundtable. Thank you so much for the great start to this workshop, tremendously motivating already, and I'm really engrossed in it. My question for the moment will just follow on the idea of the antagonist that we've been pursuing a bit here. And as it's been said, that it's necessary to have that and to have some hope associated with that in the intersect. I'm wondering if you feel the antagonist needs to be identified as sort of an individual, an industry, an entity like that, or can the antagonist be the status quo in some way? How tightly does it have to be defined versus the current reality that is, I mean, we've talked so much about the creation of health is not from one entity. The lack of the achievement of health is not from one specific antagonist, but perhaps more. So I'm struggling with who is the antagonist and how to define it, and is it singular? And really the multiple factors of the status quo. And somebody else started off by saying, you know, having more than one objective. Is it more than one antagonist, that we've got 3 dragons to slay, basically? Or you know, how narrowly does it need to be defined, and what are the pros and cons of that?
Yeah, great questions. You know, I was thinking of the tobacco industry. It was easy when you had those guys standing, all the tobacco heads standing up in court, you know, that you could see them. That made it easier. So I think my answer would be, yes, you can mobilize against something more abstract. It's easier when you can put a face to it or a name to it. But I think the question that you raise is absolutely the right one. We can't always put faces and names to the antagonist. So we have to think about ways in which you can make the challenge to overcome structures, beliefs, practices, institutions.
I think we sort of distinguish between power over and power with problems. Like, you know, where there's a problem that is a function of a lack of collaboration, when collaboration could solve the problem, like a credit union, for example, there's no need for an antagonist there, except in the sense that, gee, we should have less, you know, we should have cheap credit. I had a friend, a former student, is organizing a credit union in Washington Heights in Dominican community, and they're going along organizing their credit union, and all of a sudden the opposition came out of the woodwork, and who do you think the opposition was? Who do you think it was?
Big bank?
No, they weren't threatened. I think I heard it. Yeah, check cashers, the loan sharks. There was a whole industry of predators based on the powerlessness of that community. The community started to empower itself, and all of a sudden these people came out of the woodwork who were threatened by that, who were trying to stop it from happening. So even when we think we're just being collaborative, power dynamics being what they are, we often wind up in a situation in which conflict comes our way. But I think when it's clearly a question of power over, like take the fossil fuel, you know, how do we tackle climate change or it's like unless we can define points of agency, you know, that can make impact on it, we tend to just sort of go around in circles. You know, there's going to be costs attached to change. There always is. Because the way things is the way they are. Now, we want to change things. That's going to cost somebody something. And so then the question is, under what conditions will they accept that cost? Well, usually not happily. So then it's a question of how to turn it into something that becomes tractable in human terms. So I think it's a strategic problem. And without that kind of ability to focus and say, okay, we're going to take the bus company in Montgomery, Alabama. We're going to ignore schools, housing, everything. We're going to focus on this. This is going to be our initial focus. That way we're going to build the capacity to move on to the next thing. We run the risk of just sort of diffusing all over the place and not getting the kind of purchase that we need.
Can I add just one more point, which is I would also argue, though, for looking for allies wherever you find them. And so I go back to the example of the gay and lesbian mobilization for partner benefits, that there were people who were working with corporate higher-ups who managed to convince those corporate higher-ups that it was more of a cost to not provide those benefits than to provide them. Right? Those were important allies, and they actually helped the movement to affect real changes. So I think it goes back to your point about how broadly do you want to cast the opposition, and to Marshall's point that we are opposed to people who are getting in the way, but welcome people who are allies.
Okay, we're going to finish with the three, and then we're going to need to take the break. Yes, please.
So I'm Michelle Larkin. I'm a member of the Population Health Roundtable, and I work for the Robert Wood Johnson Foundation. So I had a question. We've been talking a lot this morning about the antagonist, which cutting my teeth in tobacco control, I absolutely get that. But as we've worked on issues like childhood obesity and hunger, and the multiple factors that influence health, like housing and education, there's a role there for new relationships, right? Francesca, you talked about sort of the blurring line between the elites and the community power, as well as talking about the need to have new relationships and really be able to leverage those relationships and tap those networks. Talk a little bit more about how the antagonist perspective connects to those relationships, because business, for example, can at one time be an ally and in the next breath be an antagonist for us. And how do you maintain those relationships and keep those networks well connected and trusting so that you can come together, work on the common areas, and when you have to separate, be comfortable in sort of critiquing each other and really pushing each other to change and move forward for a better outcome?
Marshall, do you want to start with that? I think that's a great question. It's a real challenge.
No, you know, it's the sort of thing where longtime combatants develop a relationship of respect, where there's sort of, you know, it is only business, as they said in The Godfather. You know, it's not, it's nothing personal, and it's not. Yeah, it's tricky. Because life is not simple. You know, what you were saying about obesity, and there is an enormous scope, I think, of possibility, especially in the whole domain of health, for collaborative, aggressively collaborative ways of working and operating that engage community partners with clinicians, with administrators. I think that, and we're involved in a couple of projects like this in South Carolina, another one in New Zealand. I think the challenge is where the folks holding the power say, we want the community to be engaged, so please engage the way we want you to engage. Thank you. And the problem is that the power inequality gets in the way of that. And so unless the community has a way to organize, to become an equal partner, to where it can actually become a collaboration, then I think, then there's a ground for real collaboration and real agency being exercised at the community level. And I think that's one of the hazards I've seen in that. We're actually involved in a project with the New Zealand public health people in Auckland with the Pacific Islander community, youth community there, where there's a big diabetes issue, and they wanted to engage the youth and took an organizing approach. It turned out the youth were a lot more concerned about youth suicide, and have been building an organization there that is now able to enter into a relationship with the public health people. I mean, it's an experiment, but it's pretty interesting, and we're collecting data that actually shows that the young people involved in the leadership teams that are functioning well also show positive health outcomes. I mean, which kind of makes sense when you think agency is good for you, you know? I mean, so I don't mean to digress, but I think there's a lot of possibility in that area, but it means being realistic about it and recognizing the way power can get in the way. It's important. But I think there's going to have to be a lot more of that, and how it's convened and who convenes it and under what conditions, I don't know. Because the one other thing I'll just say is, and maybe I'm speaking out of turn here, but I've been shocked in the last 3 years about how much interest there is among medical students, public health students of all kinds in organizing. You know, I teach organizing at the Kennedy School, and 4 years ago, rarely anybody. This last year, we had 20 students from School of Public Health, half of them doctors. That's something new, in my perspective. And I think there's something stirring to happen out there that you probably sense better than I do, and I'm hoping that some of that energy can help figure out some of these things.
Public health, as you know, is an issue that crosses all kinds of boundaries, institutional boundaries, disciplinary boundaries. And so I think we might want to think about enlisting professionals in the effort, right? So urban planners could take up the issue and run with it and develop their own movement to create urban planning that's more responsive to public health concerns. I think there are all kinds of alliances that could be made, and I don't want to imagine a kind of central group directing these efforts. I think what's important is that these different groups, like medical students, say, or urban planners, come to feel that this is their issue, that they own it, and that they want to mobilize around it.
Good morning. Thank you both for very wonderful talks. I'm Martha Gold from City College of New York, and I wanted to draw on two things. One, Francesca, you talked about some of the resonant values that Americans have, cost effectiveness being one of them, and equality being another one of them. And in this Conversations of the Roundtable, of which I'm a member of Population Health, we've really talked about the sort of different constituencies we might appeal to with different kinds of messages. You know, business, the power structure, is certainly interested in cost effectiveness, but large groups of Americans would presumably be interested in equality. Nonetheless, the cost message hasn't really, from the public health perspective, from the broader social determinants, hasn't taken shape. People don't do that. And the equality issue, which, is being rather well publicized with incredible disparities in life expectancy, also hasn't been sort of an organizing piece yet. So, Marshall, you talked about making what's important urgent, and I'm wondering if both of you might talk about sort of how we might light more fires to get more urgency.
Francesca, you want to go first?
I'm struck by how much media attention there is right now to the inefficiencies of healthcare provision. The New York Times is running a story now on hospital costs, and so there seems to be real interest in the kind of arbitrariness as well as wastefulness of healthcare spending. And so, to me, that's an opportunity to make this, here is a way in which we really can bend the cost curve, as they're talking about it now. So I think that's, taking advantage of these political opportunities. And then as far as equality, one, it's the problem that we always run into when we're fighting for equality, which is what's equality of opportunity and what's equality of result. But I think also the added challenge that people in the field of public health have is, as we've talked about, it being seen as a kind of personal, individual problem, right? So if you're obese or you have asthma, you just need to take better care of yourself. And so we just need more public messaging saying that people should take better care of themselves. So how do you get across the message that a poor baby and a middle-class baby are going to have different life expectancies? Right? To me, that's compelling. How do you get people to see it as equality of opportunity rather than equality of result?
I think urgency is created through action. I mean, it's sort of like here at Harvard, a number of years ago, there was a general view that it would be a good thing if janitors were paid a living wage. And everybody thought it would be a good thing. Nothing was happening. Nothing would be done. Nothing was happening until one day 28 students went in to visit the president and just decided to stay in his office until something was done. Now, it's not as simple as that, but they spent 3 years building up a base of support in faculty and students, in the city council, and so forth. So this was not sort of like a fringe thing. So they were very smart about how they chose to do their civil disobedience. So what it did, it took this sort of general concern and all of a sudden ratcheted it up to the top of the urgent list. What am I going to do about these students? What am I going to do about my students? And it went on. It went on for about 20 some days. And eventually they won. I mean, the thing got resolved. Now, they don't win all the time. But, Wall Street made the thing urgent. Occupy made things urgent. We didn't quite know what to do with it. So it's not all about action. But one way to make things urgent is through action, under the right conditions. Because it sort of says, look, I'm not going anywhere. This has got to stop. And at a certain point, that's what has to happen with these things. And that's where the whole question of moral courage comes in, and risk-taking, without which we don't see much occur in the way of change. So, timing matters, all the rest matters, but I think it's important to recognize the realities of what it does take to often make things urgent.
So let me just say one thing here. I have had this thought flashing through my head about sort of radical action. I come from the era of the yippies, et cetera. If you were going to do something really that galvanized action about inequality, you might do something that was very offensive to people. I was thinking about the notion of, showing up at a cemetery during a funeral of a very affluent person who lived to be 95 years old, with a lot of people saying, we only get to live to be 65. I mean, that would give you a lot of publicity, but that would perhaps not be seen as sensitive. But I don't know how you, I don't know how you mobilize, around something as big as this. And I guess that's sort of how do you create urgency? Give me an example. See,
that's the wonderful, that's where the creativity comes into this whole thing. I mean, You know, in India, who would have thought that salt would be a way that Gandhi could mobilize such enormous confrontation with the British Empire around salt? I mean, or the American colonists in Boston organizing a confrontation with the British Empire around tea. Or farm workers organizing a confrontation with California agribusiness around grapes. I mean, it's a question of finding the students when they did the sit-ins they started the sit-ins in North Carolina and all that. That was a way to make it urgent in a really cool way, because it was like, hey, I'm just putting my body in this place where it's not allowed but ought to be. See, there's an elegance and a kind of simplicity to great nonviolent tactics. And because I think you're right about the cemetery. I don't think that would be too cool. But it's finding ways that are consistent with what, in other words, it's a rhetoric of action that's consistent with what you're seeking. One of my old friends and colleagues just finished fasting for about 21 days back in D.C. in the Fast for Families around the immigration reform issue, Eliseo Medina. Along with a young man named Cristian Alvarez and a young man from the Korean community, and then others trying to bring some moral urgency to the immigration reform. Well, it's probably not going to get it this Congress, but they're looking for ways to try to do that. I think they're going to probably span out across the country. Maybe that will, I don't know. But there's no easy answer to this. But think about it. Look, the moral authority of people who do what you do is enormous in this country. It's enormous. I mean, you know, the moral authority puts you in a place where you have a lot of leverage. And I don't know if it's fully realized.
No,
but,
it isn't.
You know, it's one thing for people with no resources to sort of be a change constituency. It's another thing for folks who, you know, come from a place of resources to be a change constituency. And so, I don't know, think about it. I look forward to what you come up with.
Thank you both.
Okay, we have just to make closing comments before we take a break. So any closing comments?
Oh, just thank you for this opportunity. I look forward to hearing what you do with this, because I applaud your efforts, and as a scholar find it fascinating, but also as a person find it really inspiring.
Marshall, we so appreciate your joining us. Closing comment from you?
Well, just again, I just joined Francesca. Thank you very much for the opportunity to have the conversation. I really do think that there is something stirring in this whole world of healing. And the dissonance between being called to healing and the commodification and bureaucratization that's faced in trying to do it is growing. Both, not just because the system's becoming more problematic, because I think the expectations of people who are called to this calling are raised. And I think that's a good thing. And I'm hoping that that can be a source of change for us. Thank you.
Great. Thank you. This really, as a member of the Planning Committee, it exceeded our expectations. I thank you so much. We're going to now take a 30, not 30, you're going to come back. You're going to come back at 10:35, have a break, and we will continue this conversation throughout the day. So if your questions didn't get answered, I'm hoping that at some later point you will get it answered. Thank you. Thank you, Marshall.
Thanks very much.
Bye, Marshall.
Bye, Francesca. Good to hear.